Hi, everyone. Welcome.
Hi. Good evening, everyone. Well, we all know that February marks Black History Month, and UMHS asks if we can lead this live discussion about Black women in medicine.
Yes, yes. And I'm Dr. Swearingen, and I have my colleague with me.
I'm Eboni Peoples.
Okay. And we're going to start talking about Black women in medicine, a conversation about the Black experience. And that was the title that was initially posted. And that's what we're really going to get into. So just a quick introduction. I'm Dr. Swearingen. I am a first year resident at UMHS, University of Arkansas Medical Sciences in family medicine. And I also have my bachelor's in biology and a minor in quantitative genetics. I went on to get my master's as well in healthcare administration. And then from there, I did a post-baccalaureate and I got my bachelor's. And I got my post-baccalaureate in biology and also physics. And then I went ahead and did another post-baccalaureate in microbiology at Dana-Farber Cancer Research Institution in collaboration with Harvard School of Medicine. So just really quick, some of the things that got me into medicine, what kind of drove me into this was that at the age of 13, I was diagnosed with type 1 diabetes. And I came from a family with a background that did not know too much about medicine. I mean, we knew my mom was the corner store nurse, she treated me how she could, but for the most part, nobody in my family knew anything about medicine. And so I wanted to figure out how I can control my medical condition and optimize it to the point where I didn't have any complications from it. And it started opening my eyes to the field of medicine. And I came from a large family of 7. My mom was a school bus driver. She retired with that. My dad is a cook. And so just learning about medicine was something that I wanted to know more and more about. So that's a little bit about me. I'll pass it on to my colleague over there.
Well, everyone's journey into medicine is always so different. I went to University of Florida for undergrad and grad school, and I just knew I was going to work at the CDC, and that's not what happened with my public health degree. So I ended up doing some sickle cell research, and a mother came to me and she said, you're going to stop the pain that my child feels. And from that little seed, I went ahead and applied to med school. So now I'm here now, still in med school, trying to figure out what it is to life and how to better serve the community. While in med school, I've been really involved with AMSA, and AMSA is the American Medical Student Association, and the advocacy about different issues that affect people is just driving my passion to become a physician even more if it wasn't there before. From reproductive justice to health equity, I never knew that medicine had these options besides being a clinician. So I'm very grateful that I even listened to that mother who told me that I was going to stop the pain of her child. I may not do it with the farm, but it may be through advocacy and just being there for patients. So I mentioned that I'm a medical student now, and there is a big difference between like mentors and sponsors. And I don't know, can you tell me why is representation important in medicine to begin with?
And honestly, that's a really good question. Before we jump into this, I know there's a lot of questions about what is this talk going to be about? What are you listening to? Let me just run it through really quick. These are some topics that we really wanted to cover in this conversation. Like I said, it's a conversation between you and us. And we're just going to talk about what it's like to be a Black female physician or someone in the medical field, practicing medicine or studying for medicine right now. And we want to just give you the truth behind it. Don't sugarcoat anything and just let you know the reality of what it is, what you're going to be faced with, and some of the stereotypes that still exist today, and some of the systemic racism that even I have seen just in the short time I've been practicing medicine. And then we also want to talk about the lack of trust and mistrust that of the Black community in the healthcare system. Why does it exist? How do we tackle those issues? What can we do about it? And hopefully we can get you guys to kind of come up with maybe some ideas or solutions and the question and answers, or even talk about some of the experiences that you went through. And we can just talk about and discuss that. And then next, Ebony's probably going to touch on this more because she worked with patients who trying to get them COVID vaccinated. And especially within the Black community, there was a large amount of mistrust going on. So we're going to talk about that. Why did that exist? Where did it come from? And then also the importance of being a mentor, being a sponsor, and why we need more Black physicians and Black female physicians in the healthcare system and the medical field. And then lastly, question and answers is open up to you guys. Whatever you guys want to ask, whatever you guys want to talk about, that's what we'll do. So Ebony, you asked some really good questions about the importance of mentors and sponsors, and why do we need that in the medical field, especially of Black female physicians. And one of the key stats that I wanted to point out is that the Black community represents about 14% of the population in America. And what's really interesting about that is that only 4% of the physicians practicing today, only 4% of them, there's already a small amount, but 4% of them are Black physicians, Black doctors that are practicing. And of that 4%, 2% of them are Black female physicians. So it's a really small amount of just Black female physicians that are practicing medicine compared to a population of 14%. And so just having that small amount makes it really difficult to kind of reach some of these issues that are going on and the mistrust or distrust in the Black community. Maybe Ebony can kind of tell us a little bit more about why it's important.
So going through this whole process of even applying to med school, like we have mentors, and a mentor is someone who helps you, gives you advice, but it gets to the point like after you complete STEP and you're applying for residency, now you need a sponsor. You just mentioned that 2% of acting providers in our country are Black women. Like they look like you and me. Well, we need another voice. Like we need someone who's more than just a mentor, and that's a sponsor. And a sponsor is someone who has that power to advocate for you. They put themselves on the line to speak for you. They go behind the doors and they're talking about, hey,
Very true.
we need her here. A sponsor is someone, if you're a candidate for a position at the hospital, a practice, a sponsor is someone who's going to open that door for you and make sure that someone gets a look at who you are. I think the difference between a mentor and a sponsor in the field of medicine is that a sponsor can tell you if you're ready for the next step. I think a mentor grooms you, gets you dressed up, but the sponsor is the one that's like, hey, today's your first day at work.
They really push you. They push you to get to that point.
Because their reputation's on the line. And I think in the case of that statistic that you brought up, with even just 4% of providers being a person of color, someone being Black, there's going to be other people that we need to sponsor
Mhm.
us, not necessarily people that look like us. So this conversation is just not for people who
Mhm.
may identify as Black or African American. We need everyone here. This is something that we all need. We use the word
Yeah.
allies a lot when it comes to different inequities. So we need allies in the case of making sure we have representation as physicians.
And Ebony, I want to kind of just dig a little deeper into that too, and also why it's important to have representation out there who kind of look like you, or at least, from the Black community, because microaggressions still exist today. And again, like I said, the short amount of time I've been practicing medicine, the short amount of time I've been working in the hospital, I've seen stuff. I've seen stuff that it's not necessarily blatant, it's not upfront, but I have experienced situations where I have went into a patient's room. I've clearly told them, "Hi, I'm Dr. Swearingen. I am your physician. I'm your doctor." And I've said it multiple times in multiple different ways. I actually have to wear a name tag on me in the hospital
Is
that
this
says
doctor?
physician, really big. Yeah, doctor, physician, just so patients know that I am their doctor. Because one of the things that I'm seeing is that patients look at me, they sometimes just assume that maybe I'm their nurse, or maybe I'm a medical technician that's coming to help them. And I actually had a patient report to some of my bosses that they didn't see the physician that day. And
Wow.
and that really started to affect me in the way I practice, because you know, to know that I went into that patient's room, I talked to them, I helped them, and I treated them. We had a good conversation, and in their mind, they're thinking that, okay, I had a good conversation with the nurse, or I had a good conversation with the lab tech, and I'm upset because the doctor never came in. What do I do about situations like that? How do we change this stuff? What do we do? And it's just, I feel like having this platform to talk about it, bringing up issues like that really helps, because even though this is little things, little microaggressions, this could play out in my medical performance. It could
Mhm.
appear as though I'm not seeing the patients, or I'm not treating them when really I'm there. I'm on the forefront. I love what I do. I love being a doctor. I love helping patients, but this has to change. Mhm.
I I think, at least my opinion, I feel like what you just shared with us, your personal experience,
Mhm.
is just not patients who have like an unconscious bias of what a doctor looks like. Um, Faculty has it, medical directors, my colleagues, we all have some sort of underlying bias when it comes to practicing. And this is a crippling mindset that we have as even students, because when we're doing our rotations and there's no one in the hospital that looks like us, there's
Mhm.
no patients that look like us, and to be mistaken for a technician or any other staff, it makes you feel like I don't belong here.
Mhm.
And you know, we call that imposter syndrome, and it's very
Yes.
real. And the danger of this is that as students, as people of color, we can internalize that to be true, and we do belong.
Mhm.
And like you said, like when you start feeling this way, it's like it affects your job performance. um
Yes. Yes.
I have friends who are doing rotations and they're like, I wanted to be a surgeon, but now I don't think I can. I don't think this is for me because of what, and it's really unfortunate. And I think that's something that goes unnoticed in our journey, that I might be the only person of color in my class and nobody knows how I feel.
Mhm.
No
Mhm.
one sees, the extra time it takes to make sure my hair looks a certain way, or that, let's say if I was a Black man, that I'm not raising my voice because my voice can seem intimidating to a patient.
Mhm.
Um,
Yes. Yes. Very good points. Very, and I'm glad I'm actually honest. happy that you brought that up because, you know, it's always that, and I tried so hard going into this profession. I was like, okay, I know I'm going to be labeled as the girl with the attitude or something like that. And, you know, I smile all the time. I've been teased for smiling too much. And you know, you go into this and immediately, if I don't say something a certain way or if I don't present myself a certain way, then I can come off as having an attitude. And a lot of that has to do with stereotypes that still exist today. And so, again, having this platform, talking about it, putting it out there, not just um, kind of making people aware of it, but you know, helping other people from different backgrounds and cultures that may not be experiencing this or could be helping these stereotypes to exist, maybe opening their minds that, you know, maybe I shouldn't do this. Maybe let me think a different way. And then for young Black physicians or students that want to go into medicine and practice medicine, you know, I really want this talk to be something that can reach you and just so you can understand that this stuff exists. You know, don't let it get to you too much, and just kind of just keep going. Remember the whole reason why you started this field and this journey.
And
I also
while
want
that reason, like you need to have confidence and self-awareness of who you are. Like you're mentioning, like remember your why and why you're doing it for the
yeah,
patient, right?
yes, exactly. Exactly. And that's the main goal. I do want to kind of talk about the patient now that you mentioned the patient, and especially amongst the Black community, it's a big topic that still exists today. Trust, creating trust within the Black community.
Ooh.
And why are we still seeing that there is a lot of mistrust in the healthcare system? And this isn't just, you know, a couple of people here and there. This is generations and generations of mistrust. And I was just talking to my mom and my dad the other day. My mom's from deep South Alabama, and one of the things that she said was that she would tell this story about the paddy wagon, and that if you don't get inside before a certain time at night, the paddy wagon will get you. And so one day I asked her, "What is this paddy wagon? Like what's going on?" And she said it was actually a van that her mother, my grandma, used to tell her will grab you up and take you away to some foreign place and do experiments on you. And
Wow.
so this is a scary thought that even to this day, you know, it's still the idea that the Black community, Black people are being thought of that if I seek medical help, if I seek treatment for a medical condition I have, I don't trust it because I could be used as an experiment. And it's understandable because back in slavery, Black people were being used and treated with experiments to, you know, go through forced sterilization. Then you have the infamous Tuskegee syphilis experiment that pretty much everybody knows about, where Black men with syphilis were treatment for syphilis, like penicillin, was being withheld so that Black men can be studied on the long-term effects and outcomes of syphilis and what it can do to your body. And so it's just horrific things that were being done to Black people in the past. And so now we're trying to figure out, how do we erase this from everybody's mind? How do we move forward? How do we get generations of Black people to somehow trust the medical field? And one of the ways is having more Black representation out there. Whether or not you don't have to be a physician, you don't have to be a doctor, but even nurses, having Black nurses out there, having Black medical professionals out there, just seeing us more in this position where just kind of opens the gate of trust. And I just want to point out that a statistics that was found was that in October 2020, a poll was done that showed 7 out of 10 Black Americans say they're treated unfairly by the healthcare system. 7 out of 10, that's the majority. And then 55% of Black Americans say they still distrust the healthcare system. And that's a scary thought.
In residency, do you have any experiences that you can share about like where you actually see people, like the actual consequences of people not seeking treatment because they just don't trust their doctors?
Yeah, I mean, well, some of the biggest things, and that's a really good question, is that, Black people suffer at a higher rate compared to, our white counterparts in terms of, or suffer at a higher rate from really debilitating chronic preventative medical conditions such as diabetes, high blood pressure, asthma, heart disease. A lot of this stuff is very preventable if you just get the health care and the treatment you need up front. And unfortunately, with this mistrust or distrust of the healthcare system, it's kind of hard to really start saying, hey, take these medications, it's going to help you, it's going to prolong your life, when the trust is not there, and people just don't believe in it. And unfortunately, it messes up the life expectancy of the Black community, and further more problems go on down the line. And Ebony, I think you kind of experienced some of this too with the COVID-19 vaccines. You were on the front line trying to get more people to take it.
So, I've always heard my family say like, oh, you go to a doctor for one thing and you come back with everything else. And it's like, these chronic illnesses exist, but they're not being treated. So when the pandemic happened and you're just trying to do your part, educating your family and friends to get vaccinated, it was just another struggle because it's like, oh, this coronavirus is brand new. I don't trust the vaccine. They just came up with this. Where's the research? Well, when you share the research, oh no, this is still too new. I don't believe it. So not being in the clinical setting and just being at church, being with your family and just saying, okay, this is what the virus is. These are the different options. What is your hesitancy? Tell me what's going on. Is it that you need more information about the vaccine, or do you not understand how viruses work? Tell me what it is so I can educate you where you have that lack of knowledge. Months and months and months and months of just talking to the people who I see every day. So that trust that you mentioned, it's so deeply rooted in our community. It's insane.
Yeah.
And I don't think COVID made it any better, but I do appreciate the fact that when the vaccine came out, there was a Black woman mentioned who was part of the investigation of, getting this vaccine out. Was it enough? I'm not sure the statistics of how Black people are now vaccinated or fully vaccinated, but we are struggling as a community. We are struggling as providers to break this. And I think that we have to change the culture somehow, and getting that trust back, because it's making it very difficult. At least I'm hearing, because you're actually a physician, is making it difficult as a physician to provide the care that you want to give. If you're have this wall up, like, I mean, I don't know. I hear, but I don't know.
I know, and you know what, Ebony, and I do want to touch on that. And again, just some of the things that I have experienced while in medicine in the short amount of time I've been there. And I completely understand why the Black community is still hesitant, even till this day, to trust the healthcare system. And I had a patient not too long ago, a Black female patient came in. She was my patient, came into the hospital. She had COVID. She was COVID positive. And, when I went to see her in the room, just looking at her, she looked like she was suffering. She just didn't look right. And immediately I looked at her pulse oxygen level. And normally for someone like you and me who are just relaxing here, our pulse oxygen level should be above 95% to 100. That's a good level. Usually we start getting very worried if it's below 92%. And then anywhere below that, we're scared. And so this woman, I looked at her oxygen level and it was around 88%. And it was dropping between 82%. And so I immediately talked to the woman and I saw her sitting there just kind of laying in the bed. And I asked her, I was like, is everything okay? Are you having trouble breathing? And she was just like, no, 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 I'm fine, I'm fine. But I was like, no, you don't look fine. Something is wrong. You need oxygen. I stepped out that room immediately and I went to the nurse and I told the nurse, and I was like, this patient that's a patient that just came in, she's sitting in the bed, she doesn't have oxygen on. It's very concerning. Please put her on some oxygen because she needs it right now. And I just remember that day, the nurse just looked at me and she was like, oh, she's fine. She bounces up and down. She goes as low as 76%. And I was like, 76? Her oxygen level is going all the way down to 76% and she's not wearing oxygen. What's going on? And then they're just like, oh, she's fine. She's okay. And I was like, look, whether or not you think she's fine, I am her doctor. I am the physician. Put her on some oxygen now. And I just kind of got that look. And they looked at me and it was a weird look. And then they're just like, okay. And they kind of dragged their feet. So I had to actually log into this patient's chart, contact respiratory therapy, and immediately get them to come down there, get a consult, get them to come down there just to put her on some oxygen. And it was something that really helped her. It helped her because she was becoming very confused. And I still think back to that moment, that situation to this day. And I think, were they dragging their feet on this patient because she was a Black woman? Were they dragging her feet because I was a Black female doctor asking them to do it? If I was any other race or gender, would things be different? If she was any other race or gender, would things be different? I have to ask myself that, or it's just their personality. It's just, is this how they are? Just with everyone, but it's the microaggression, is stuff like that you don't know what to do about it. And unfortunately, I wonder what would have happened to this woman if she did not get that oxygen. What would have happened? And so these are definitely issues that need to be talked about, need to be put out there, and need to be addressed and changed.
Like, I'm hearing this and I'm like, this is no different than like the statistics about like Black women going into delivery, right? So there was a study, the University of Minnesota, the University of Minnesota School of Public Health, they published a study about hospital births in Florida from 1992 to and the researchers found that while Black newborns are 3 times more likely to die as white newborns, when the doctor of the record recorded the Black newborn was Black, the mortality rate was cut. So we have Black babies dying, we have Black mothers dying, we have Black patients dying. For what reason? And thank God you were there to advocate for that patient about her pulse ox being so low. It just goes into the conversation of like why representation matters.
Definitely.
Part of the 2% is not enough. You can't equate a life to be any less than what it is. Everything should be at 100. So I guess my next question, or I guess topic that I think we should talk on would be how can Black providers create better health outcomes for Black patients?
True. How can, and I think that's the most important question that we're all trying to figure out, and not only better health outcomes, how do we get patients to trust us, especially patients from the Black community? And also, why is Black representation important? And it's a lot of different things. I mean, number one, you feel like you have a physician or someone out there that's your advocate, that's advocating for you, that you can trust in, because this is going to be someone that understands kind of maybe what you went through. Maybe they won't fall under some of the stereotypes that were placed upon the Black community, or it's just not allowing biases or any of this to interfere with our medical decision making. And so a lot of this really helps when you have more Black physicians, Black medical professionals, and all of that in the medical field. I think another way to kind of help out with, I think the question you asked me, Ebony, with how do we, get through this challenge? How do we get more, I believe, more mentorship out there? Was that the question? Yeah.
Better outcomes, but that makes sense. Like we need more mentorship. Like what does diversity look like even in education, right?
Hmm.
Comes to like even like pre-health advisors or our
Yes.
faculty in school or faculty in the hospital. Where do we find these sources? I mean,
Hmm.
are there enough programs out there, like pre-med programs? Are there enough organizations while you're in med school? Where's the support system? I guess that's what I'm trying to figure out. Like, where do we go?
and that's the answer. That's what we need. I'm really happy that UMHS has given us this platform to kind of talk about this. The medical school has really opened up the doors to accepting more, or just using a holistic approach to accepting students that come from maybe different backgrounds, and not using only their test scores to try to judge whether or not they qualify, but taking a holistic viewpoint on what they're going through. I really appreciate my residency program that I'm in now, UAMS, just for taking a chance on me. And I feel like they also took a holistic approach in deciding which residents they wanted to put in their residency class. And that's something that I like. And they definitely support Black outreach programs and mentorships and guidance. And I love when, someone who maybe not be in the position of being, maybe they don't have the microaggression directed towards them, but yet they know that there needs to be a change. And I appreciate these programs just reaching out and doing this and being involved in this and addressing these issues. Also, just kind of what we're doing right now, talking about it, making people aware of it, hoping that it will help people to open their mindset, hoping that it will help the Black community to, sometimes you have to advocate for yourself, especially if you see something that maybe that you're concerned about in the medical field. You have to advocate for it and just speak up and say, let me just ask some more questions because this doesn't sound right to me. You don't necessarily have to have a Black provider to know that you can have someone that you trust, because there are a lot of my colleagues that I work with personally that will definitely get rid of the stereotypes and treat you as a patient, not as you're a Black patient or you're a patient with these stereotypes. So that's what I'm hoping that this talk will really do. Just open up people's mindset, open up people's eyes, and kind of change the stereotypes. And let's get rid of that.
Well, did you have a mentor
Hmm.
at point during this time until I guess Orgo 2 to residency? Did you have a mentor is someone that you can go to for advice and support?
Oh, of course. I mean, other than our parents, our moms, our dads, people that you love, siblings, I had mentors all over the place. I had mentors during my medical programs who I worked with, did some shadowing in their clinics and pediatrics and family medicine that just talked to me, and they were willing to kind of put me under their wings. And so that really helped. I had mentors who were friends, that colleagues that just gave me some advice, just like, sometimes you're going to experience this. This is what you're going to experience as a Black female physician. But this is how you handle it. You handle it with grace. You don't take it to heart, and you just have to remember why you started this path in the first place, why you started this journey. You always have to come back to that. And that was one of the biggest things that they installed in me that kept me going to this path. I don't know if you had any special mentors that kind of helped you, Ebony.
Honestly, I feel like those who have been mentors were never like the doctors. They were either like a bus driver, because I didn't have a car.
Oh,
So it's like when I would see her and she'd be like, "You still in school, baby?" I'm like, "Yes, ma'am." Like, you focus. So I think it's interesting that we're like, I keep thinking of that number you said, 2%. Like,
yes.
and I come from I from Miami. Everyone, so many different types of people here. And it's just
Mhm.
amazing that the population is what you said, 14%, but only 2% are doctors.
Mhm.
It just doesn't seem real if you're expecting your provider to be someone who looks like you. It's just, how is that? It doesn't work out. Um,
Mhm.
I'm wondering, um, what what are some, what's it, tickets or tokens? What are some tokens you can tell someone who is interested in going into medicine?
Yeah, some of the things is, and I know, we're getting a lot of questions out there, so I definitely want to make sure we answer those questions. But one of the tokens or tickets or advice I could give to someone who is interested in going to medicine or who's doing this path right now, again, is to just think about, always remember why you started this journey. It's not an easy journey. It's going to be, the one thing you think that, being a Black woman in medicine, that you're going to struggle with studying for exams and passing tests, but you realize there's that other extra burden put on you about, dealing with people, having people that have biases and stereotypes already embedded in their mind, that you're not the doctor, who are you? Kind of that whole imposter syndrome. Why are you here? And that's another extra layer of things that you have to deal with when you are a minority going into this field. And so it definitely puts an extra level of challenge on you, but just keep being focused. Just keep thinking about the main goal and reaching out. You can never do anything by yourself. You need a community, you need support. You need to make sure that you open up and talk to people about this and reach out to as many people as you can. I think I had maybe 14 or 15 mentors just to get me to this point that I'm in my life right now, in my career journey. And so I had a whole village of people supporting me, and I really appreciated that, because I'm here today and I'm helping other people. And so just going forward, if anybody's out there and they're thinking that, I still have questions, I want to go into the medical field, or I'm a patient and I want to know why this doctor's treating me this certain way, or I need someone to advocate for me, or just if you have any questions, feel free to reach out to me on my Instagram page at Dr. Swearingen. And I will try to help you or talk to you as much as I can. It is crazy at the hospital, but I will try to help you, especially if it's something concerning. I don't know if you had anything, Ebony, that you might want to say before we get into questions.
Um, I just hope that this conversation, that who is ever listening, that the monocultural of what a role model in medicine looks like, I hope that in time that we can change that. I hope that when people think of their doctor, they can see themselves.
Mm-hmm.
You know, we have stereotypes that we are faced with being Black women. There's a stereotype of what a doctor looks like. And I just really hope that we can break that down and challenge that. I really hope that we can do that in our lifetime. We have a lot of questions to get to. So I'm going to ask you the first one that popped up on our live stream. So how can we connect with the more Black doctors and health professionals, or at least those who are culturally competent clinicians?
Right. Haisha. Okay. So how do we connect? Well, one way that I connected, and it was just, sometimes it's just about honesty. For me, it was, I was doing rotations in the hospital as a medical student and just rotating with other physicians and just saying that, may you just please help mentor me or guide me because I need more help. And just sometimes being honest like that really helped out. There, you know, I'll probably say maybe if you have a physician that you really like that you see regularly as your primary care physician, you can always just open up to them and just be honest, or see if they have any recommendations to kind of refer you out to someone. I don't know if you can kind of add on to that, Ebony, since you're going through that process as well.
I would say that if you like someone, immediately that just means like there's trust. And once you have a positive experience with someone, you're going to say, hey, that was a really good doctor. I think you should go there. And just like that feedback, I think is what's going to make a big difference too. If we're talking positively about the experience you had with that doctor.
Yes, yes, very true. Also doing any type of events that show up. Like I said, things like this, being there, asking questions, this is always good. Good way to connect. Hopefully we can do more of this in the future, and that way we can get more physicians on board that people can just connect to and ask them questions that they want to know. Let's see, the next question. This is, let me make sure I'm saying it correctly. Urso Mayo. So the Black community is your support system. We must uplift and celebrate our Black doctors in the presence of other doctors. Show how we trust your schooling and prefer you as a primary physician. That is a great statement, and I really appreciate that. And that's very true. So thank you for that.
This one, I definitely agree with you. I recently graduated from PA school from UAMS. Oh, alumni.
Okay, okay.
Diversify your school and bringing awareness to the changes that need to occur. I really enjoy my time. So someone who, Bria, she enjoyed her time there.
Oh, wonderful. Thank you, Bria. Let me see. Oh, we have another one from Ursula as well. A personal responsibility is to request Black doctors through your insurance company. Oh, that's a good way too. Quickly you learn how few Black doctors and providers are in their network. That is very true. You're right about that. And okay, and there's a question for me. How do you handle patients that might be racist or biased toward you and get them to relax and listen to you as a doctor? Ooh, that's a challenging one. So I actually have this experience somewhat, and my colleagues have this experience too, unfortunately. But if there's any patient that just does not want me as their doctor because of the color of my skin or because I'm a female or for any reason like that, whatever reason there is, I definitely, I listen to the patients and I respect their decision. If they don't want me as their physician, I will pass them on to my colleague and just kind of say, hey, there's a patient here that prefer someone else as a physician. And I try to keep it simple. I try not to cause any type of issues or complications other than that. And I think that's the best way you can deal with those situations. Try not to take it personally. Try not to blow it out of proportion. Just, it is what it is and it happens. That's the reality of it. It happens and you just got to keep moving forward. There are 100 more patients that need your attention and want your attention at that moment. So, like I said, don't harp on it too much. Just pass them on and go to the next patient.
Here's another question. Oh, this one's for me. Okay. How do you deal with the bias in clinical rotations when there are almost no people of color in a hospital? Immediately after that day, I'm calling my mom. Just to let her know I'm having a tough time, or if you have an interaction similar to what you just explained, where they don't want care because or they don't want care because you're a woman. I always remember my why. Like, I want to be a provider because I want to make a difference. I want to see a change in populations. So just digesting that, like, I'm here because I want to make a difference. Even though no one looks like me, I still want to make a difference.
Yes.
So just keeping that care is care, and I want to give the best care possible.
Very true. Very true. Very true. Let's see. Next question. Oh, it's from Dr. Edith Young. Hello, I'm the chair of the Diversity and Inclusions Committee at UMHS. How can we be an ally for our students? Oh, okay. By the way, Allison Shipp was a member of this committee as well. Okay, thank you. So the question is, how can we be an ally for our students, and what can be done?
I think I have a suggestion for that. When we have, I know what, 2 summers ago with George Floyd, that was really hard. And I think when you have a position as chair of diversity and inclusion, I think that's an important time to reach out to your students of color, because America was going through a crisis at that time and it was all over the news. And just to know that your university supports you, I think those are like key moments that you can help and show allyship with your students. I think also encouraging these conversations, allowing, I want to speak up about this, and just giving them the platform to do so. I think that's a great way to become an ally.
Yeah, I definitely agree. Having more of these outreach programs and just kind of reaching out to students, and these platforms are great, because I think too many times I am hearing the stories from my colleagues of their experience going through medical school and as a resident, and some of the stuff that they dealt with. And it's microaggressions. It's nothing that's just outright there. It's little things, the way you've been treated, and there's something wrong, but you don't know what to do about it. And so being able to just allow these platforms to exist is a wonderful way. Doing more things, especially with George Floyd, and being kind of on the front line saying that, hey, we represent UMHS, we support the Black community, we support Black Lives Matters, we support all these things that are going on. That really helps, and it shows that you are actively there. You want there to be a change, and I think that's wonderful. I love it. So let's see the next question. How did mentors help you as a Black woman during medical school? Can you talk about someone at UMHS or in clinical rotations? And what is the difference between a mentor and a sponsor in medicine? Oh, wow, we got 3 questions in here. So we'll definitely try to hit these points really quick. So maybe I could kind of address the first one. How do mentors help you as a Black woman in medical school? Definitely a lot. I mean, more than anything, just a support system, making sure that I was studying the way I needed to study. There were so many times in medical school I just wanted to give up, and it's tough. It is. I mean, it's really, really tough. There was a lot going on, financial issues that I was faced with, and not being able to pay for my loans, or just making sure that my family was okay, dealing with deaths that happened in my family during that time. And so just having someone just telling me to keep going, believing in me, trusting in me, that, my family always did that, but having someone in the medical field just saying that really is, it's just says a lot, and it kept me going, and it just raised my confidence. And one of the things, I didn't think we touched about it too much, Ebony, but mental health is very represented, is highly represented, especially in the Black community. But you don't know this stuff because we're afraid to talk about this. We're afraid to talk about depression and anxiety that exists. It's kind of shunned and it's looked down upon. But we got to stop being afraid. We got to know that if you're feeling depressed, if you're feeling down, reach out to an advisor, reach out to a psychiatrist, reach out to anybody to just get that help that you need. And it's common. It's more common than not. And we can't be afraid to talk about this. I think the next question was, can you talk about someone at UMHS or clinical rotations that kind of helped you mentor you? Maybe Ebony, you can touch on that.
I would say when I came into UMHS, I did ARP. And at the time, the ARP director became my mentor immediately. And I still talk to him to this day. He checks in on me. And I'm so grateful to have even gone into UMHS with the ARP program. And it's an accelerated program to make sure that you're ready for medical school.
Yes.
And I'm a non-traditional student because of my age and the gap between my school. So I needed the ARP program just to have faculty who was just there and still there for me now. But that mentor is not a Black woman. So it just goes to show that support has so many different facets, right? So I'm grateful for him, Dr. Matos, if you're watching. Thank you for everything. We have another question.
Yeah. And I do want to be mindful a little bit. We have about 7 more minutes. So I'm loving this conversation. I'm loving being able to talk about it. But if you guys have any questions or anything, let's try to get them in, and let's go to the next question. Go ahead.
So this is a statement. We need more Black primary care providers, PCPs, but those specialties are often looked down upon by some in the medical field. What are your thoughts about dealing with this double dose of disrespect for those wanting to be general practitioners?
Yeah, it's just, and for me, I'm in family medicine, so I think you really have to just honestly just trust, do what you want to do. That was one of the things that drew me into family medicine, and it was because it's when I think about being a doctor at a young age as a child, I thought about somebody that was taking care of old people, young people, babies, everybody in between. And also I thought about what do we need more of? What do we need a lot more of in the medical field? And there's a scarce amount of general practitioners, just primary care physicians out there. We do not have enough. And so I wanted to try to break those boundaries and change things, and making sure that not only did we have more physicians out there, but we have more physicians of color and more Black female physicians to deal with. I'll go back into the stats again. The Black community is suffering at a higher rate from these preventative diseases, diabetes, high blood pressure, heart disease, asthma. These are stuff that needs to be addressed. And if it's not caught early on, it can lead to worse outcomes, lead to heart attacks and all these other problems down the line. So we really do need general practitioners to step in and get more people involved in wanting to, you know, take care of their health. And so that's pretty much my thoughts. I'm open for it, and hopefully we can get more people to kind of consider that. And even medical students that are watching, if they're unsure about what field to go in or what specialty, we need you. We need you as general practitioners. We need to help close these gaps. So
Wow.
mhm.
I know how I feel about just hearing you because I see myself in you, right? I see it, and I just hope that people who are listening, if they look like you and me, that they know that we are there to help them. We are there to make a difference, and our hearts are in the right places. This is definitely part of the experience of being a Black woman in medicine. Just hearing
Mhm.
people who can be an inspiration.
Mhm.
So I thank you for sharing everything that you said tonight. I don't really have anything else to wrap up with.
Aw, thank you, Ebony. Thank you, everybody, for tuning in, taking your time out of your busy schedule, your busy day, just to kind of talk, ask these questions. Let's put them out there on the table. Let's start talking about this stuff. And one thing is that sometimes mis the assumption is that, okay, this is in the past. We're not dealing with slavery no more. It's all over. It's done. No, that's not the case. It's still going on. It's not to that level, not to that extent, but we still have systemic racism going on in the medical field. We're still having a large population of the Black community who still do not trust the healthcare system. So until we can get a solution to that, until we can figure out the answer to these problems, then we definitely have to keep talking about it. We have to keep talking about it, putting it out there and getting more people involved and opening up people's eyes so we can make a change. So I really, really appreciate everybody who tuned in today and asked some wonderful questions. Please share the video. Please hit me up if you do have any questions. Again, Dr. Swearingen on Instagram. And I love you all. Take care. Have a nice day. And we'll chat some more. Bye.